Hello, how are you? I'm Fabiola Molina, a physiotherapist and expert in non-invasive neuromodulation NESA. Today, I'll tell you about a patient who came to the clinic in September 2019 with a problem in the entire lower hemisphere of their leg and the quadriceps, which worsened during exercise. This patient also had an associated problem of absence and was in the process of diagnosis just when we started physiotherapy treatment. The patient also began undergoing tests in the hospital. They had a polysomnography, and fortunately, during this test, the patient had an epileptic seizure, leading to a diagnosis of right prefrontal epilepsy. This case is super interesting to share because it's a patient we started treating for lower limb pain that didn't respond well to physiotherapy. But as we treated it focally, it didn't improve correctly. Focally, we used a program 2 for the anterior part, along with a 6 and a 37. Even so, the pain didn't improve and we started central treatment. Once we began treating centrally, all those epileptic absences improved during the month. This improvement in the absences also reduced the muscle tone in the affected lower limb, leading us to think there was an association between the increased tone in the leg and the epileptic seizures. This patient has been undergoing treatment for 2 years, experiencing various episodes. It's true we relate the improvement in epilepsy also to the introduction of pharmacological treatment for his problem. At a certain point, we never knew for sure if the improvement in his symptoms was due to the application of our treatment. Yes, it's true he preferred to feel much better, or due to the medication. Well, recently, 6 months ago, the patient stopped coming for 3 to 4 months, during which we always applied central programs with a 2 program for the prefrontal cortex, a 30 or 45/7, and then we always put 5 minutes of program 8. Why 5 minutes of program 8? Because we realized that program 8 was very effective, but not for 15 minutes. When we applied program 8 for 15 minutes, the patient couldn't sleep well. But without program 8, he reported more epileptic symptoms. So, in the end, we decided to apply program 8 for 5 minutes, and over 2 years, we adjusted this treatment, finding the key to be a P2, a 45 P7, and a 5-minute P8. Recently, as I was saying 6 months ago, the patient stopped coming to NESA, continued with his medication and everything, but stopped coming for sessions. In the second month of not attending the weekly sessions, he began to suffer a severe bout of epileptic seizures with absences. At this point, he decided to resume neuromodulation sessions. We started treating him again with leg pain, again with epilepsy symptoms, and during the first weeks, we treated him 3 times a week. Then it went to 2 months, and then we went back to once a week. When we returned to once a week, the patient had again reduced epileptic seizures significantly and the sensation of hypertonia in the left leg, which is the case. This is a curious example of how we initially treating a problem in which we weren't focused because we never focused on the epilepsy but on the lower limb problem. Often we have to change the objective of our therapy and adapt it to other symptoms the patient may have that could be associated. Because of this, I remember the phrase by Hippocrates, which is much more important to see what person has the pathology than what pathology the person has. Thank you very much.